New Mexico was one of 31 states and the District of Columbia that expanded Medicaid under the Affordable Care Act. And like many of those states, our rate of uninsured residents has dropped. But with an ongoing budget crisis, the state is struggling to find money to fully fund Medicaid and access generous federal matching dollars. Some lawmakers are worried about the long-term fiscal impact of the program on the state. Advocates argue that Medicaid actually brings a big economic boost to the state. Now, looming over all this is the promised repeal of the Affordable Care Act by President Donald Trump. Correspondent Megan Kermick looks at this issue for the People, Power, and Democracy Project.
I'm joined today by Sarisha Monet. She's with the New Mexico Center on Law and Poverty. Kelly O'Donnell is an economist and researcher with the Robert Wood Johnson Foundation Center for Health Policy at the University of New Mexico. Sarisha, since the passage of the Affordable Care Act and the decision by Governor Susana Martinez to expand Medicaid eligibility here, our uninsured rate has dropped from 20% to 9%. What has this meant for the state, for individuals and families?
The Medicaid expansion for New Mexico has been just a huge benefit to families and to kids in New Mexico. Not only did our uninsured rate drop, but our insured rate for children went up. So now we have 95% of our kids covered in New Mexico, which is just unprecedented. You know, we've never had such a high insurance rate in the past. And you know, what it means for a family is that folks who were unable to go and see a doctor in the past or be able to get surgeries or necessary medical care now have that ability to be able to go and get care and have access to care.
So they don't wait until something gets really
exactly.
bad.
And so you don't have to wait until something becomes an emergency anymore. You can actually go to the doctor to get annual exams, to get prescription drugs, and all of those things that you need for medical care. And the flip side of it too is that it also protects against medical debt. So in the past, you know, we've had clients and folks who've come to the center before who had just these outrageous medical bills, you know, anywhere from $30,000 to $300,000. And you're never going to pay that off as a family. I mean, that's the reason why healthcare was the biggest driver of bankruptcy in the past, is because of these bills. So that's been a huge benefit as well, you know, reducing medical debt and allowing people to have financial security. So the peace of mind, not only about your health, but also about your finances, was a great benefit to every family.
And I'm assuming, I mean, they couldn't pay that medical debt. Somebody ate that debt.
Exactly. If it wasn't the family that ate it, then it was a healthcare provider. So, you know, hospitals had these, you know, hundreds of millions of dollars worth of uncompensated care costs, meaning care that wasn't paid for by anyone. And so they were basically taking those costs and having to, you know, find a way to meet those costs. And then what would happen is they would pass it off to everyone else, so to insurance companies, and then all of us, you know, who are paying private insurance, you know, too, would end up paying higher private insurance rates. And interestingly, New Mexico had one of the highest cost-shifting rates for private insurance because we had so many people who were uninsured. So, you know, because healthcare is sort of the zero-sum game, you know, there's going to be costs, you know, that come out and it has to be paid somehow. And so if it's not paid by the state, then it's paid by a healthcare provider, it's paid by, you know, private citizens, and it has to get paid somehow.
So the Human Services Department, who we asked to join us today, they did not make anyone available, so we don't have them in the conversation. But the Human Services Department said that it's pushing for $42 million right now to fund Medicaid this year. Your organization argues that to fully fund Medicaid, the state needs to put up $78 million.
That's right.
Why?
Well, the $42 million is what the Human Services Department has said they need in additional funding for the fiscal year 2018, which is the next budget year we're, you know, deciding right now at the legislative session. You know, that $42 million would just keep basic services. You know, the reason why it's higher than last year is because, you know, some of the federal contribution for Medicaid is going down. You know, there's higher enrollment, medical inflation costs, and other factors. So, you know, if we don't fund Medicaid by providing that $42 million, then there will be cuts to services. You know, there's been cuts last year already, and we'll see more cuts to services, you know, entire benefits that we may lose, including dental care has been put out, you know, as an option, vision care. You know, already the Human Services Department is now looking at increasing fees in the form of copays. So every time you go to the doctor or to the hospital to pay $50 for a hospital visit on the lowest income families. And so the $42 million is a necessary baseline. But that doesn't get us back to last year's levels. So last year there were also cuts to Medicaid as well. So, you know,
and those cuts were to provider
Exactly.
How much providers got reimbursed
Right.
for giving care to
Right.
Medicaid patients. Okay.
So what Medicaid paid to providers last year, it was cut by about $26 million in state funding. And when you take into account the federal match of $4, so every dollar the state puts in, we get a match of about $4 for federal funding. So in total, our healthcare system lost $120 million. And it came in the form of reducing payment rates to providers, which caused a huge outcry, of course, amongst healthcare providers, because Medicaid already, underpays for so many services. And then to take a cut on top of that, what it means is that providers can't provide services. They can't, they refuse to take Medicaid patients, which we've already seen. They can't expand their facilities, and we have serious workforce shortages in New Mexico. So to be able to, get our provider payment rates back up to where they were would take an additional amount of funding above that $42 million.
Kelly, we're in a severe budget crunch right now, but we're looking at a $125 million gap to fill. Why is there an economic argument for Medicaid being beneficial to New Mexico? We've heard the health argument.
Well, Medicaid is beneficial to the New Mexico economy on a number of levels. First and foremost, a healthy population is beneficial to the economy because people can work and go to school and do the things they need to do to support themselves and generate economic activity. But in the more immediate term, as Sirisha mentioned, every dollar that New Mexico invests in Medicaid is matched by roughly $4 federal dollars. So most folks, I think, would consider a 4-to-1 return on investment a pretty good deal. And so when those federal monies roll into the New Mexico economy, they produce support jobs in the healthcare sector, and those jobs in turn impact virtually every other sector of the economy. So we see tens of thousands of jobs created as a direct result, of our investment in Medicaid. So our state economy is far more dependent on Medicaid spending than a lot of folks realize, and Medicaid is generating a lot more general fund revenue. That's revenue from personal income tax and gross receipts tax than anybody is ready to acknowledge, I think.
The expansion that was paid for under ACA to add more people to Medicaid, over 200,000 people, those premiums are being paid for right now about 95%. By the federal government. So we're only kicking in about 5%. And then other Medicaid funds, the federal government picks up the majority of Medicaid costs right now. So is there a place where, do we have to reach a certain level to get federal matching funds, or it's just we put this in, we get this much federal, we don't put this much in, we don't get this much? Essentially,
at this stage, we are at a point where what we put in is matched. So it's not a block grant. It's an entitlement in the sense that the money that we contribute to the Medicaid fund is matched by the federal government.
So right now, the impact on the state could be drastic if we don't fund Medicaid fully. We lose that match, and so we've already heard. And yet we're struggling to find the funds to pay for that particular what we have to put into Medicaid.
Well, the fact that we're struggling is a man-made crisis.
Okay.
Number one, Medicaid is generating plenty of revenue for the general fund. It's, and again, it's something that we're not willing to acknowledge because I think it's more convenient to say that there's a Medicaid budget crisis. But be that as it may, we have a tax system that is what we have is called a structural deficit, and that means that the revenue sources that we currently have at our disposal as a state are not sufficient to support just a basic level of services, state services. What we need to do is to bolster our revenue system, and to do that, we simply need to increase some of the taxes that we have decreased unsuccessfully over the last 10 or 15 years. The reality is we cut taxes on a number of our base revenue sources with the expectation or the promise that would generate economic development and that folks would invest more in New Mexico as a result. But we haven't seen that. What we've seen, in fact, is divestiture. The economy is in a worse place than it was before, and at this point we're actually losing some of our best and brightest because people come out of college in New Mexico and can't find high-paying jobs. And that situation gets worse if we systematically underinvest in the foundational pillars of our economy, which is an educated and healthy workforce.
Sarisha, there's a number of proposals floating around right now. You know, one would involve perhaps foregoing some basically closing some loopholes on hospitals so that would contribute more to the Medicaid fund. There's also a suggestion by HSD for copays and for deductibles, which is pretty common in private plans. Is that realistic to ask Medicaid recipients to do that?
No, it's not realistic to ask Medicaid recipients. You know, the idea behind copays is that somehow if we ask people to pay a copay, that they will, it will make healthcare more efficient, that people will go and use only the necessary services that they really, really need because they have to pay some amount for it. And what studies have found is that not only do you lose some of the necessary or unnecessary services, you lose necessary services. So it means that people will choose to forego, going to the doctor in the first place, and then you have that emergency room problem you were talking about before, where people don't get the care, then they end up in the emergency room. So it ends up costing more in the long run for the state to save very little amount of money to be able to do, and it's a hit, on people who are the most vulnerable in terms of, low-income families, low-income folks who have disabilities, seniors, who are all, become part of this. And you can imagine if someone has multiple bills over a month, that can add up. Paying a copay each time you have to get a prescription drug, or each time you have to, visit the doctor for, some test, that will add up for our families. And so it's, it's almost like a hidden tax, which is probably the worst part about it. It's coming from an administration that has said, we don't want to tax families because that'll hit people's pocketbooks and hurt working families. And yet just last week, there's this proposal now by the same administration to increase copays, which is a direct hit on people's pocketbooks, on people with disabilities, on seniors, on low-income adults, which really didn't have to happen. And from, my perspective, and I think it's shared by a lot of people, there's far better ways to raise the revenue and to fund Medicaid that wouldn't, hurt our families.
Well, and I want to say again, we did ask the Human Services Department to join us, and they could not make anyone available today, so we don't have their perspective. What are other ways? We're all scrambling. Do people want to pay more taxes? It's interesting that the hospital, some healthcare organizations are willing to maybe pay more taxes, but do we want to ask people to pay more taxes? Well,
the way that this has been characterized, I think, in the media is as though, everybody's suddenly going to have to pay much more taxes, which is none of the proposals that are floating around right now would do that. They're all of the tax proposals are ones that would end tax breaks that are not necessary for New Mexico and that wouldn't, hurt everyday people in the way that, it's sort of been characterized. For example, one of the initiatives would be to, end income tax breaks that have been given to the wealthiest, people in New Mexico. That was something that was done under Governor Richardson, where we now have a flat income tax structure because of it, which loses a ton of money, and that wouldn't affect most people in New Mexico to just end a tax break that is not necessary. Capital gains, tax breaks, again, it's people, mostly upper income who have investment income where those things could be ended. There's alcohol and tobacco taxes, which, are not being taxed at the rate they should be, given the amount of healthcare costs that they have on New Mexico. There's corporate tax cuts that were made that primarily benefit out-of-state corporations and really large corporations that could be ended. There's gross receipts tax loopholes. So there's all kinds of things, in this system, right? Well, it's like, do we want to be? One proposal, for example, is to create some fairness for small businesses by taxing remote internet sellers. So, some of the big companies out of state that sell online we don't tax, and yet we tax our local businesses in New Mexico, which is just not fair for local businesses.
Well, Kelly, there's a proposal, maybe, we don't know what it looks like yet, but an idea from the federal government to make this a block grant program. And would that be a good thing for New Mexico? What would that look like?
If making Medicaid a block grant would be a very bad thing for New Mexico, because it essentially would fix Medicaid funding roughly where it is at the time that it is turned into a block grant.
We already know health costs are skyrocketing.
Exactly.
Across the board.
Exactly. So. And people are getting older, and they're incurring higher health care costs as a result. So fixing Medicaid spending at a certain level and then expecting states to get creative in order to continue to fund services at the current level it would be an impossibility. It would be a huge hit for New Mexico. But it's important to keep in mind that where we are, if and when a block grant is instituted, where New Mexico is in terms of federal funding is where New Mexico will stay. So when we forego federal funds by failing to find the revenue we need to match Medicaid, we set ourselves up for a state where we are receiving even less from the federal government, and that situation is permanent as opposed to a year-by-year decision.
Well, I want to thank you both for coming and talking to us about this.